Hello, this is Eitan Shalom at the Body Mind Wellness Center, and I'm here today with my patient who is a ballet dancer. I've made another video of her that's already up from a couple of years ago, where I was emphasizing how effective dry needling is for trigger point release, and that even somebody who's fine-boned and sensitive, you can even use the ultra-fine needles, which is what I was doing with her then. Those are the red needles. These are the blue ones. These are the normal gauge. Those were the extra thin gauge. So she has progressed over the years in her ability to tolerate dry needling. Now I'm doing a combination of dry needling and acupuncture for her. So she has Morton's neuroma on both feet. It was severe years ago when I first met her. It's now very mild, and it flares up once in a while, and that's when she'll come down to nip it in the bud. So these points here are, you can say that this is dry needling. These are not acupuncture points. You're using the needles to needle into the benign fibroma, that's the Morton's neuroma. Sorry, I'm going to pull over my stool. And what I wanted to point, sorry about that, terrible camera work. We'll fire the cameraman after the shoot. And that's better. So these are the points that are, man, you haven't seen your toenails until you get a close-up. So this is the Morton's neuroma there. And you're needling right into it, and you're releasing the muscles that are the muscles that go from bone to bone in the foot there. But now I've also done dry needling here, but this is, this one here, which is an acupuncture point, but I also am releasing the muscle between the toes there. My theory is if somebody has Morton's neuroma, I want to release as many of the muscles between the toes as possible, at least the main ones, like that one and then this one. So this is an acupuncture point. And so the point that I'm going to make now, she also landed incorrectly on her foot and felt like she jammed her ankle. That's the term she used. And so this is the point between the bones here on the lateral malleolus, and this is a point that's just inside the tendon of the tibialis anterior. And this is an acupuncture point, liver 5. This is an acupuncture, I said liver 5, I meant liver 4. This is an acupuncture point, gallbladder 40. And the point I want to make, and let's come over to my book here, is that the difference between dry needling and acupuncture is that dry needling, you're using the needle to release trigger points and to stimulate motor points in the muscles and fascia. You can also do dry needling into ligaments and tendons as well. Acupuncture is based on the theory of the flow of qi through the channels. And when we look at the indications of this point that I'm doing here, just inside the tibialis anterior, and it's on the liver channel, you can see that it spreads the liver qi, regulates the lower abdomen. The jiao means in this case, it means the lower abdomen, clears liver channel stagnant heat. So look at the diseases that you can treat with this. Pain and retraction of the genitals, hypogastric pain, a lot of different things involving the genitals and the abdomen, because the liver channel flows through the lower body and it flows through the genitals. So we treat a lot of menstrual issues and also male genital issues through the liver channel. Difficulty urination, painful urinary dysfunction. So this is a very popular point that spreads the qi that flows through that liver channel. It's nothing to do with your physical liver per se. It's the channel that's named after the liver. Pain and swelling of the lower abdomen, abdominal discomfort after eating. So people that feel overly full whenever they eat, this is a good point for that. And also people that they eat and they get pain after eating. Look at these interesting difficult defecation, no pleasure in eating. You know, that's an interesting one. liver type people, wood type people in Chinese medicine are often exactly the kind of people that treat eating as a necessary evil rather than something to take joy in. But now this relates to the physical liver, jaundice, green complexion, malaria. So that's things related to the physical liver. Now we get to the last group of symptoms, which are not less important because they're last. Low back pain. Let's just get down to the bottom. Pain and swelling of the medial malleolus. That's the inside of the ankle. So the point that I'm making is it's a point used for ankle pain, but in acupuncture, it can be used for many things. And it's one of the tricks with acupuncture is finding points that sometimes if somebody comes in with ankle pain and the gut issues, well, then that's an even better point to use. So then I'm also doing the motor point of the tibialis anterior. I'm doing a couple of trigger points on the tibialis. She also has some mild hip pain, and we have, you see the mark there from the surgical marker. Before I needled her, I palpated to find her tender points. So she has some mild stiffness and not even, would you call it pain, or is it more stiffness? Stiffness in her hip. And she was very good at identifying where she feels it. And so I needled these points, trigger points on these muscles. You okay? Strong. And I'm just gonna, this is called the pistoning technique in dry needling. Sorry, this is bad camera work, but I'm only one man. There we go. Oh, good one. Okay. All right. So that's my ballet dancer with Morton's Neuroma. Morton's Neuroma, right and left. I did the same points on each side. A stiff ankle, especially on the right, and then the hip stiffness. Thanks for tuning in.